السلام عليكم طلابنا المرحلة الخامسة. نستأنف محاضراتنا. هاي تكون المحاضرة الأخيرة طبعا اللي هي ما لحقنا نشرحها خلال الكورس، اللي هي عن طريق تخص ال Geriatric Urological Disorders, Urinary Incontinence، وأيضا كان عندنا محاضرة الأخرى اللي هي Pediatric Aneurysms. الانكونتيننس هو سلس بول بالelderly patients والyoung patients يسموه incontinence، بالchildren والinfants يسموه aneurysms. هو بالحالتين عبارة عن سلس البول. Incontinence could be acute or chronic. It's a neurological problems that affects both genders, male and female. It causes many psychological disorders, cost effectiveness disorders, medical problems. تعرفون geriatrics with incontinence, uncontrolled urination. فتسبب المريض من الناحية الاقتصادية لازم يستمر على أدوية. Psychological problems، يبدي يعزل نفسه، ما يختلط بالناس، embarrassment and so on. دائما لازم التويلت تكون nearby. That's why it is very common problems in both male and female. كل geriatric patients اللي أعمارهم ممكن تكون فوق 65 سنة، أو أحيانا it affects adults إذا أكو فد other causes, disease or drugs or other risk factors سنجي عليها. As a neurological considerations، يعني من ناخذ physiological aspects of the urinary bladders and incontinence. اللي يتحكم بها هو ال central nervous system and the bladder outlet. As you can see in the brain, in the cortex, we have a cortical bladder center, which is micturition center. السنتر الخاص بالmicturation التبول. It is innervated with the brainstem, and then in the dorsal sacral nerves، عضلات الفقرات الموجودة بالظهر S3 and S4 that innervates both the bladder المثانة and the bladder outlets in internal and external sphincters. Once this cortical center, micturition center, is inhibited, there is always a relaxation of the bladder, a relaxation of the trusor muscle بطانة البلادر الداخلية اللي يسموه the trusor muscles عن طريق ال proprioceptors. فتبدي يسوي filling، تجمع الإدرار. Once the patient is willing to urinate, or once the capacity of the bladder is overwhelmed, the patient should void the urine, and there will be a stimulation. This inhibition will be ceased, and stimulation of the micturition center, the brain, and then it will innervate or sends an impulses to the brainstem and then to the dorsal sacral vertebrae, and then they innervate. The trusor muscle will be relaxed. Once it is relaxed, the patients can urinate through opening of the internal and the external sphincters. This is the controlled nervous system. In the bladder, we have the detrusor muscle that controls the urination through the proprioception receptors, which are muscarinic receptors that are innervated from the sacral nerves. And then the bladder outlets, the internal bladder sphincters under control of adrenergic receptors and estrogen in female. The external sphincters under voluntary control muscles. Yani patients can control his urination. It is also under the control of estrogen in female. That's why in postmenopausal female, this will increase the urination capacity because of the reduction in the level of the estrogen in geriatric females. In general, the causes of incontinence it could be disease-related, drug-related, or it could be age-related changes. The resnix mnemonics, which is diapers، هي مختصرات major causes of urinary incontinence. D, delirium and dementia. I, it is the infection. A, it is the atrophic vaginitis اللي يصير أكثر شيء بالبوست menopause، ضمور بالatrophic urethritis، atrophic vaginitis، atomic bladder تكون كلش متحسسة و hesitated من drugs من disease whatever. It could be psychological causes, depression. P is a pharmacological agents or drugs. E is an endocrine disorders, diabetes insipidus، السكر الدائم يصير عندهم polyuria، hyperparathyroidism and hypercalcemia، كلها تؤدي لك من يطلع الكالسيوم يطلع excess water secretions فيزيد urination. R is restricted immobilities، طبعا ما دام ماكو حركة دام اكو pressure على البلادر فيزيد willing to void. And as a stool impaction هذا geriatrics أكثر شيء يصير عندهم constipation. That's why it's constipation because stool impaction. Once they wish to defecate, there will be straining, and this straining will end up with the leakage of the urine outside the bladder. While the age-related changes with the elderly patients, it is caused by many physiological changes, differs in women or in men. In women, definitely it is hormonal problems related to the estrogen production, decrease in the estrogen production, and in the men it's age-related change with the enlargement of prostate cancer. And in both genders, the problem is related to the true muscle instability. تبقى العضلات المثانة تتعب with aging. فتقريبا 20% of patients are asymptomatic ما يحسون بيها لكن increases with age. Then age-related changes in neurological functions is decrease in the bladder capacity. دائما bladder capacity هي 400 مل تقريبا. بعدين أكثر من هذا it will send impulses to brainstem to urinate. بالgeriatric patient تنزل حتى capacity 300 ml and could be less. Increase residual urination volume. دائما أكو residual volume هذا يزيد أكثر شيء بالmen with prostatic enlargement. Increase uninhibited bladder contractions. يعني bladder always hesitated. Increase in the nocturnal sodium fluid excretion. هذا من geriatric patients midnight necturation أكثر شيء يصير عندهم. Decrease urethral resistance in women because of the decrease in the estrogen. فدائما ماكو resistance تكون أكو flow. دائما sphincters are opened. And increase urethral resistance in men because of the enlarged prostate will reduces the passages because of the same passages between surrounding the prostate اللي هو urination passages مجاري بولية اللي هي تحيط بها prostate gland. فمن يصير enlargement حيزيد resistance in men اللي هو عكس conditions اللي يصير women. And also there is a weakness in pelvic floor in women نتيجة multiple pregnancies تضعف عضلات المثانة وعضلات pelvis. Either it could be drug induced. Some drugs that can, especially in women with stress incontinence, when they are taking alpha blockers for hypertension or for the any other cause, bazosin and so. These blockers will antagonize the effect of the internal sphincter and leads to excess urination. That's why it should be switched to the other forms of antihypertensive drugs, especially calcium channel blockers is more effective. The classification could be acute incontinence, could be chronic or persistent incontinence. Usually the acute is transient one because of disease-induced, drug-induced, psychological conditions, but the persistent اللي هو دائما يصير geriatric patients نتيجة structural change. It can be classified into four types. It is urge incontinence, stress incontinence, overflow incontinence, and functional incontinence. The acute one, it could be related to the acute problems such as infection in the bladder, cystitis, atrophic vaginitis. It could be urethritis, infection in the urethra in men, polyuria because of diabetes, and many other diseases. Disease induced could be drug induced. هذه دائما تسبب لنا acute conditions. دائما إذا أكو disease drug drug تسبب لك acute conditions. Once you can control disease, discontinue drug, all things would go to the normal situation. But the persistent one, it is a chronic conditions. The persistent one, the most popular one, is the urge incontinence, which is most common one, affects both men and women. It is involuntary voiding preceding a warning, few seconds. يعني هو patient يحس إنه هو دائما عنده إحساس إنه دائما he needs to void، لازم أكو toilet يمه يكون قريب. هذا دائما يصير نتيجة hesitation بالdetrusal muscles، تكون instability دائما متحسسة الdetrusal muscle موجود في المثانة، فتسبب دائما urge he needs to urinate even the bladder is empty، فلازم يروح toilet. It is caused by sometimes detrusal hyperreflexia. It is instability، يعني دائما أكو neurological innervation، أكو دائما stimulation to the detrusal muscles، فدائما تكون contracted، always contracted. It is common cause of local genitourinary conditions. مثلا دائما أكو cystitis، دائما بها التهاب المثانة باستمرار، بها tumor، بها stone، بها التواءات verticular، بها obstruction. كل هاي تسبب دائما أكو innervation، دائما أكو contraction لل أحيانا some diseases اللي هي ال CNS diseases، Parkinson, dementia, stroke، دائما أكو تأثر على innervation of these bladders. The other type is stress incontinence. Stress incontinence دائما يكون leakage، دائما يكون at day and night once there is stress on the bladder. أكو ثقل على المثانة فتكون stress incontinence. دائما يكون هذا uncommon in men, more common in women. In elderly women دائما يكون associated with pregnancies, multiple pregnancies, or having persistent cough or any load that causes stress on the bladder during daytime. أحيانا أكو وايد patients حتى من يعطس هو أصلا يصير عنده urination. In men it is rare conditions unless the patient has passing into transurethral resection to the prostate اللي يصير عندهم هي حالات post surgical for the prostate يصير عندهم stress incontinence. Otherwise it is more predominant in women. أحيانا حتى الobesity فالإنسان with daytime urinates a small amounts and infrequent nocturnal incontinence and low post-voiding residual volume. It always occurs with the urethral instability, stress conditions. Even stress incontinence could occur predominantly day and night time according to the cause. Even the obesity may cause stress incontinence. The overflow incontinence, usually the overflow incontinence, it occurs predominantly in men more than in women. This occurs due to prostate enlargement, predominantly the overflow incontinence. It is occurs due to the increase in the weight of urine that remains in the bladder. دائما أول patient بال BPH prostate enlargement أكو فد obstruction بالflow of the urine فيبقى residual volume يرجع backflow of the urine يتجمع بالبلادر. هذا with time may cause irritable bladder ويزيد hesitancy of the bladder فيكون interrupted urination. دائما يقول لك أنا لما أروح الإدرار ما ينزل كل الإدرار فيبقى كله شوية شوية. That's why يزيد residual volume. هذا residual volume may cause overflow incontinence يعني نتيجة overflow تجمع الإدرار الموجود بالبلادر اللي هو ينزل شوية شوية نتيجة obstruction. أكو obstruction. It occurs predominantly in men with BPH or any tumor in the prostate or sometimes in neurological problems, diabetic neuropathy, fecal impaction, any other drugs that decreases the flow of the urine تعرفون anticholinergic drugs تسوي cessation of the urination فدائما يبقى back flow of the urine. Functional incontinence is not a physiological or pathological cause. It's caused by psychological conditions يعني patients who were unwilling to reach the toilets يعني هو patients ما يقدر يوصل للتويلت ما في أي إشكال بالفيزيولوجي of the urinary system يعني ما كان عنده مشكلة بالبلادر ولا بالأوتلتس ولا المشكلة patients عند مثلا is disabled patients عند muscle weakness patients عند mental status patients with psychological problems ياخذ medications patients أكو شيء يخلي patients to reach the toilet فهي it is not caused by drugs or not caused by psychological physiological abnormalities with aging. The clinical features يعتمدون على investigations to diagnose the incontinence فيعتمد patients كم مرة إيش قدر المدة اللي he suffers from these symptoms ويعتمد على imaging techniques. طبعا هي سهلة شغلة يعني it's easily to diagnose the shape of the incontinence with the shape of the bladder لحتى يعرفوا نوع الانكونتيننس اللي فيه لازم ياخذون اكس-راي للبلادرز ياخذون يسوون الأشعة الملونة للبلادر. إذا البلادر neck one it is funneling in shape يعني شكل البلادر مثل القمع نتيجة constriction of the internal external sphincter هذا it indicates that it is a stress incontinence يعني عندكم اكو ضغط فدائما الضغط ويولد انه constriction بالاخير. palpated bladder معناه اكو بيها ادرار overflow incontinence. hesitancy empty bladder معناه هذا urge incontinence لانه دائما patients he always urinates even small amounts of the urine فرأسا he wish to reach the toilet. Usually another investigations is related to the catheterization فيخلون الكاثيتر يشوفون ايش قد الفوليوم اذا كان residual volume a dynamic detrusal muscles it is another investigation type. Urinalysis طبعا لازم blood chemistry لازم يشوف renal function here general laboratory tests for the urinary system. They can diagnose the cause of incontinence age-related whether it is disease-related, drug-related, or infection, السبب incontinence إلى آخره. The treatment of incontinence usually it is the principle of treatment is related to drug treatment. طبعا لازم نعرف الكوز إذا acute or chronic. دائما treatment تكون للchronic persistent incontinence أكثر من acute one. Acute one once you discontinue the drug you can treat the condition clinical conditions you can control it but the persistent one that cause psychological cost effectiveness emotional medical problems it should be treated with the medications. The group of drugs that used to treat the persistent urinary incontinence according to the type of incontinence. طبعا functional incontinence we have no medications of course because it is related to the personality. the urge incontinence, stress incontinence, overflow incontinence, they need to be treated. الurge incontinence because of the problems with the detrusor muscles دائما تكون hesitated inner wall of the bladder اللي هي بطانة البلادر دائما تكون contracted. إذا لازم أستعمل as long as is cholinergic innervated by proprioceptive اللي هي muscarinic receptors. It's the only drug of choice for the control the conditions is using the anticholinergic drugs. Different types of anticholinergic drugs اللي هو انتم اكيد ماخذيها بالمختبرات الصيدلة الثانوية المرحلة الرابعة اللي هو ديتروبان detrols and other related medications. Oxybutynin اللي هو ديتروبان هو the most predominant commonest used. Then tolterodine اللي هو detrol, trospium the next, and darfinancin and solifinancin. All anticholinergic drugs are used in treatment of urge incontinence. كل واحد side effects مع anticholinergic drugs. So إذا patients you can switch from one to another according to the which one can minimize the adverse effect of anticholinergic drugs, especially in elderly patients. often anticholinergics مشكلتها يسوي لنا constipation، يسوي لنا dry mouth، وأكثر شيء patients يعاني من عنده هو dry mouth. دائما يقول لك أنا حلقية بس ما أخذ هاي الانتيكولينرجيك drugs، ماكو يسوي constipations decrease the fluids، عيون يصير جفاف بالعين إلى آخره. That's why you should switch from one type to another. The stress incontinence إنه هو problems with the sphincters, the internal external sphincters. That's why you need, especially in women. That's why you need to treat them with the estrogen vaginal cream, imipramil, to control innervation. So the ephedrines all can control the innervation of sphincters. While the overflow incontinence, it is related to also to the internal sphincters. That's alpha blocker, alpha agonist innervated. Overflow, I need to decrease the resistance of sphincters by increasing the flow. I should give antagonizing drugs to the alpha agonists, tirazosin, doxazosine, tamsulosin, alflozazine, bithanicol, and so on. These are the major drugs that are used, or classes that are used to treat all types of incontinence. طبعا أنا ما حشرح تفاصيل بالدراجز، كل دواء إلى تفاصيله وأنتم أكيد ماخذين بالمرحلة الرابعة، بالدوز وبالadverse effect وبالduration والfrequency of these drugs are well presented in these lectures. إذن anticholinergics mostly used for urge incontinence في patients اللي عنده mixed incontinence. دائما patients إذا كان عنده male or female يكون عندهم mixed incontinence، يعني patients اللي عنده BPH ما ينطوا فقط for treatment of overflow incontinence، دائما يكون اللي عنده urge incontinence يكون hesitated bladder نتيجة تجمع الإدرار بالبلادر، فالديتروزر muscle تكون hesitated، فدائما الطبيب يعطي وياه anticholinergic drugs ويا الألفا blockers. Meanwhile بالفيميل stress incontinence دائما تكون mixed with urge incontinence. طبعا ما دام اكو stress على البلادر فأيضا تتحسس الديتروزر muscle. You can use a combination of these drugs. Then for another group is using drugs that increase the bladder outlet resistance. هذا تستعمل دائما بالstress incontinence. These groups are, as mentioned earlier, is imipramine or estrogen that increases sphincter resistance على مود ليس leakage of the urine. عكسها drugs that decreases bladder outlet resistance اللي قلنا كل أنواع الألفا بلوكرز ممكن أستعملها بالمن most commonest than in women. These can increase the bladder passages and urine passages and reduce the bladder outlet resistance. ممكن نستعملها في treatment of overflow incontinence. In this group for overflow incontinence, and this drugs group for the stress incontinence and the urge incontinence is you can use all these types of anticholinergic drugs. Thank you for listening.